All right, back on Morningline. Thanks for joining us. February Heart Awareness Month. With us this morning to talk about it, Dr. Joshua Beckman over at Vanderbilt, heart doctor, and taking your phone calls, 737-7587. You know, Dr. Beckman, the last caller talked about statins, and I wanted to ask you about that as well. I mean, I think, is it pretty clear now? Statins have been around a long time. One of the most effective ones, Lipitor, that's been around for years. So there is a track record. There had been some question at some point wondering, okay, down the road, are some of these going to cause problems in other ways? But is it pretty much clear in your mind that statins clearly do more good than harm, if they do any harm at all?
This, I think, is one of the clearest things that we understand from medicine. So the first trial that showed that statins reduce really bad complications of heart disease was published in 1994. It's called the 4S trial. And we've had hundreds of thousands of patients in clinical studies since then. And basically, statins have been beneficial in almost every setting. Recently, a very interesting study was published in the New England Journal of Medicine, and it showed us that the muscle aches that people worry about with statins come with taking a pill more than just the statin. And so it's actually something that people, if they expect it, they're more likely to feel it than actually the medicine causes. And so we give statins out now in a way where we don't really check blood tests outside of the cholesterol level after we start it. The number of people who have a real problem from taking statins is so low. And honestly, we have changed the trajectory of heart and vascular disease by using these medications.
Wow. Okay.
I think it's one of the strongest things we do.
And I hear you on that. I want to give you, as an example, I'm waiving all my HIPAA confidentiality to share this on the air now, which, all right, so I have a history of high cholesterol. My family does, and I am not, an anti-vaxxer or someone who doesn't believe in medicine or anything. I'm all for it. If it helps, I'm one of the first people to take it. But for a period of time, I was on everything from Lipitor to Crestor, and I never had what I would call any of these serious symptoms. I had some. I had one of the statins I was on at one point. I'm telling you, I thought it was affecting some of my memory. Now, I don't know if that's accurate, if that's something that's true, maybe not. Anyway, it was never bad. But I sat down with my doctor, and my wife was involved, and I looked at the risk factors for me, and not everyone, but I was thinking, I don't want to take a pill the rest of my life. I have a genetic component, but I don't smoke. I drink very little. I exercise. I'm in good shape. I monitor my blood cholesterol on a regular basis, and I came off the statins to try to control it, through lifestyle. I would say that my total cholesterol number now is still higher than you would probably like. But my HDL and triglycerides, my triglycerides is the lowest my doctor has ever seen, and my HDL is very high comparatively with the ratio with my LDL. And as a result, even though I think he would prefer me to still be on a very low dose of a statin, I'm staying off the drug because I don't want to keep taking a pill. And I figure if the only high risk factor I have is a modestly elevated cholesterol in my life right now, I'm at low risk for a heart attack. Am I wrong?
So I think the easiest way to answer your question is to go online and use the American Heart Association risk calculator. And you can put in all the factors that are important, including your age and your sex, your cholesterol numbers, your blood pressure numbers, and whether or not you smoke. And it'll tell you what your 10-year risk is. And you can decide. Most experts would suggest that if you have a risk of more than 7.5% over 10 years, you should take a statin because it would be beneficial. It's hard for me to say exactly what to do for you without knowing all those numbers, and I do not want you to reveal them on TV.
Yeah, okay. Well, I'll tell you, I think my cholesterol is last time I checked, it was probably 240.
So my answer to you, by the way, is that this is kind of like the conversation I have with some of my kids where they ask me why they have to make their bed, because that night they're going to use it and it's going to be unmade again in the morning. Nobody on the planet was born with the desire to take a medicine every day for the rest of their lives. On the other hand, everybody would really like to feel as good as they feel right now or better for the rest of their lives. And taking medications to prevent serious heart problems is an investment in staying as good as you feel right now. So the balance is literally 10 seconds of annoyance on a daily basis to reduce the chances of chest pain and shortness of breath and severe limitation later on. That's the balance you're making.
No, that makes sense. It makes sense to me. With regard to looking at the total cholesterol number, has that changed at all? Say, looking at total cholesterol as opposed to the ratio between LDL and HDL, is one more effective to look at? Because I guess you could get a total cholesterol number that might be a little misleading if your LDL, which is the bad cholesterol, is lower and your HDL is higher, or am I misreading that?
No, I think you're right. We used to look at total cholesterol as a number basically by itself, but now we understand that there's a variety of things on the cholesterol panel that can give us a lot of information. LDL, the bad cholesterol, provides a lot of information. HDL, the good cholesterol, when it's low, also provides a lot of information. And triglycerides are probably the third of the three components that provide some information and risk. So yes, total is not that clarifying. You want each component so we know where we want to strike.
Okay, and triglycerides again, if you could explain for folks, is that kind of blood, the sugar in your blood, or what is triglycerides?
Each of these are a kind of fat that travel through your blood and bring energy from one place to another, and the triglycerides are another form of that. And so the amounts that you have are an indicator of the kind of fat that you have traveling around in your blood vessels. In general, having more LDL and more triglycerides is bad.
Let's take another phone call, and I'll continue to badger you about triglycerides in a second, but we'll take Peg, who just got through, before we take our next break. Peggy, good morning. Hi, Peg.
Hi. How are you?
Good. How can we help you?
Well, is there any herbs or vitamins that you can take that would help lower the cholesterol?
Great. You know, that was going to be a whole segment on this morning's show, Peg, and I'm glad we'll continue talking on it. But yeah, okay, the types of things you can take aside from a prescription drug like statin that may or may not help, and she was asking about herbs or vitamins.
So the medical community has done a lot of research on vitamin A, B1, B6, B12, C, E, D, and E, and not one of them really makes a big difference for heart health.
Yeah.
Obviously, if you are deficient, you need to be replaced, but it's not, taking them in high doses is not going to make you better. Red rice yeast is a product that has some statin-like qualities, but it doesn't come in a way where you have a reliable dose, and I don't think it's a reasonable substitute. Really, if you want to go in a natural way, you want to do more exercise, and you want to reduce all the foods you know you shouldn't be eating. Fried foods, lots of red meat. You want to move a lot more towards fish and vegetables, and try and get as many colors into your diet as possible.
Whatever happened with the niacin thing? Was that something that was kind of a rage and just went away, or is there still some evidence that niacin time release, so you don't get that flush, works?
So niacin does reduce cholesterol, but when it was tested as an add-on to a statin, it really did not have any extra benefit. We use it now primarily if you cannot take a statin as a second or third choice. It's nobody's first choice anymore.
Okay, interesting. And by the way, we talk about statins as the best known, but are there now some alternatives to statins that are out there if for whatever reason someone can't take a statin at all? I mean, just a whole new line of heart drugs that maybe attack it from a different angle?
Yeah, no, there's a couple of medications. There's a medication called the Zetamide, which is a pill, which can reduce your cholesterol by about 15-20%. And then there's an injectable that blocks the pathway whereby your cholesterol is regulated. The class of those drugs is called the PCSK9s. And there won't be a test, so I'm not going to ask you to remember it. These can reduce cholesterol and LDL by 30-40%. Of course, they require an injection every couple of weeks, and so they're a bit more annoying. And we typically reserve them for people who just have to have their cholesterol lowered and can't take a statin or don't get to the target on a statin.
As we go to the break, I told you that my cholesterol has always fluctuated somewhere between 200 and maybe 280 was the highest it ever got, which is high. What's the highest cholesterol level you've ever seen in one of your patients? And I know it can be substantially higher than that.
I've actually seen people who have the bad component, LDL, as high as yours has been, as your total has been.
Wow.
So, and I've seen triglyceride levels of 1,000. So, normal is under 150. So, there's always people walking around with numbers that sort of deserve to be in our, Guinness Book of World Records kind of things. Those are rarer than most people see.
All right, on that note, we'll take a break, and when we come back, we'll explain why when you have cholesterol perhaps that high, unless you're aware of it, you're not going to know without a blood test. And it's not like you feel it and say, oh, I can tell my triglycerides are up. And you just wonder how many people just, eschew going to a doctor or having a blood test when they do, and they don't know until it's too late. So we'll talk to the doctor about that when we come back right after this.